The COVID-19 pandemic in Indonesia is a part of the ongoing worldwide pandemic. It was confirmed to have spread to Indonesia on 2 March 2020 after a dance instructor and her mother tested positive for the virus. Both were infected from a Japanese national. As of 11 June, Indonesia has reported 35,295 cases, the second highest in Southeast Asia behind Singapore. In terms of death numbers, Indonesia ranks 6th in Asia with 2,000 deaths. Indonesia has conducted around 463,000 tests against its 273 million population so far, or around 1,600 tests per million, making it one of the worst testing rates in the world. As a comparison, it is way lower than Guatemala, which has only around 17.9 million population, yet has conducted 1,700 tests per million. What makes this a sad outcome is the fact that Indonesia is known for its criticism in tackling the pandemic. Health experts are concerned that the country is failing to identify the transmission of the virus. Mark Lipsitch, professor of epidemiology at the Harvard School of Public Health, has analyzed air traffic out of Chinese city at the center of the outbreak in China and suggested in a report that Indonesia might have missed a number of cases.
From what I can understand of the press, and it's very confusing, but from what I can understand from the press, the test kits did not arrive in Indonesia until after the period, or right at the end of the period at least, that we were studying. So if that's true, and if the test kits were the way you would test, then that explains it. It's not a cover-up, it's a lack of testing.
Western diplomats, as well as local and international news outlets, postulated that the lack of cases within Indonesia results from inadequate testing and underreporting, as opposed to sheer luck and divine intervention. On 22 March, a research suggested that the official number of infections may only reflect 2% of the real COVID-19 infections in Indonesia. The government has also faced backlash after instead pledging to set aside 72 billion rupiah or around $5 million to pay for social media influencers to attract tourists to Indonesia. Indonesian President Joko Widodo is also criticized by Indonesian Chamber of Commerce and Industry, human rights groups, and also political parties such as Golkar and PKS for lack of transparency regarding the information of the COVID-19. Widodo have insisted not to share the travel history details of the patients that have tested positive with the virus in an attempt to reduce panic and uneasiness in the general public. Many reports have also surfaced about patients in Greater Jakarta having to wait for a long time to get tests or treatment for possible cases of the novel coronavirus disease. According to a report, as of 28 April 2020, there were around 2,200 patients who had died with coronavirus symptoms, but has not been included into the official death toll of 693. This suggests that Indonesia has a higher death rate than the official counts. Despite the travel restrictions, which suspends all passengers to travel outside areas with at least one confirmed case, many Indonesians disregarded it and have attempted to evade the travel restrictions in order to return to hometown during Ramadan season. This has caused scientists to raise concern that this evasion will lead to the diseases which can spread easily from Jakarta and nearby satellite cities, where it is the epicenter of the pandemic, to other regions of Indonesia with weak medical facilities which are unable to handle large numbers of the outbreak.
They may have lost jobs and income, and the best way for them to survive is to go back to their villages where the cost of living is lower.
It has also pushed many animals into the brink of starvation. 60 animal parks have closed since March, leaving them with no revenue.
Kita mengumpankan herbivora kita bentuk rusa-rusaan atau burung-burung yang tidak dilindungi untuk karnivor atau yang pemakan daging.
Despite the temporary closure of the HM Sampurna due to 2 workers who died from the coronavirus, with additional 63 workers who were tested positive, Pandu Riano, the epidemiologist from University of Indonesia, has reported that other cigarette factories in East and West Java continue to operate without practicing social distancing and workers never wear the face mask. This sparks concern that the cigarette factories could create new cluster for the coronavirus outbreak, considering that this industry usually has large workforce.
Dari perjalanan epidemi ini gitu kan, bukan yang sekarang. Yang sekarang kan akan masih dalam naik terus nih kematian.
In my conclusion, this is therefore disheartening. We are reaching onto the 4th month of this pandemic and are still yet to be aware of the future outcomes.